Okay, so I'm Brandon FuquaB, and this is my ethics research project. I chose voluntary euthanasia. So I do have a short intro. The purpose of voluntary euthanasia is to help a person achieve a less painful experience, even when death is the result. Voluntary euthanasia is done when a person has a hard time doing the things they once had. They are immobile, or experience extreme pain, and many more scenarios that make death a better option. However, a big concern for some people is that they believe euthanasia is unmoral and do not support it. There are 3 points that I will discuss: support, qualifications, and drawbacks of voluntary euthanasia. So the first one is support for euthanasia. A person's choice demands respect as long as it causes no harm to any other being. It would be up to the person who is being assisted in their death and not anybody else. Assisted suicide is helping the well-being of a person. It is never a good thing for someone to be unhappy with their life and to hate the thought of living with such discomfort. Euthanasia is helping people finally achieve a sense of satisfaction. Having the choice of euthanasia might make someone appreciate life right before their designated end date, and would end in a happier state of mind when thinking about life. It could really open someone's eyes when the clock is ticking and death is becoming a reality. Euthanasia would be done by trained and skilled medical professionals in a respectful and professional way, which would leave the patient with dignity. It is not done by someone who is unqualified or is unprofessional. It is done with absolute respect. So qualifications for voluntary euthanasia. There are 5 qualifications, which include the first one: if the patient or person has been diagnosed as terminally ill. If someone is terminally ill, they might be urged to be set free from the life that they are in and agree to euthanasia. There is no need for someone to suffer when more quick, peaceful, and painless options are available. The second one: if it is unlikely that someone would benefit from a medication that is discovered during what remains during the rest of their lifetime. Number 3, if they are suffering from great amounts of pain that is unbearable due to their illness. It would not be right to make someone suffer and be in tremendous amounts of pain when there could be a simpler solution. This differs from the first point because this condition is not involved with having a terminal illness. Number 4, if a person has a voluntary and strong wish to die, or has lost the ability to state their wish, or stated that they wish to die in a time that conditions are satisfied when they would qualify. Number 5, and the last reason. The last reason is if somebody is unable to end their life without having someone's help. Someone may need the help of a healthcare professional to end their life, and it would satisfy one of the previous 5 requirements or qualifications for assisted suicide. These qualifications are considered to be strict and limiting. It takes a certain criteria, and not just anybody can qualify. And of course, there's going to be some drawbacks against voluntary euthanasia. Voluntary euthanasia can be considered unnecessary in today's time due to effective care improving and that hospice care is available now. Pain can be lessened due to different medications and drugs that get prescribed to people or patients. We do not have any evidence to be justified that a person's wish to die is voluntary and meaningful. A request to have assisted suicide does not always have truth and a real desire. Passive euthanasia is permissible due to it not be taken to preserve or prolong life, but active euthanasia is not okay because it involves an unjustifiable killing so that it satisfies the person who requested it. However, the difference between passive and active euthanasia are not clear. It is feared that if we allow and legalize voluntary euthanasia, then it will have a negative impact and lead us to legalize and support other types of euthanasia, such as non-voluntary euthanasia. It is believed that once one thing is legalized, it is much easier to legalize the thing closest to it. So it is understandable that someone would fear legalization of non-voluntary euthanasia. With voluntary euthanasia being allowed, it would most likely be legalized differently in states across the U.S. This will cause for unfair treatments to those willing to go through with the process, while there are others who wish they could participate in this act in their home state. And my sources include Stanford Encyclopedia of Philosophy.